If you are experiencing foundation issues, get a free estimate from Ox Foundations.
We're going to talk physical therapy this morning, and Ben Donahoo from Donahoo Physical Therapy, our guest this morning. Ben, good morning to you, sir.
Good morning.
Good to have you with us a little bit, and on this wet Tuesday morning. And Ben was on with us last year or so, and a lot of people are looking to physical therapy to get them back in the right mode and get their bodies conditioned. And I know you guys are busy this time of the year.
We are busy this time of year. You got athletes, softball, basketball still in season, baseball's coming up around the corner. Soccer just started for high school yesterday. I think they had their first soccer game. So we got those kids and athletes that have small injuries, trying to keep them from becoming large injuries.
You mentioned something to me a bit earlier before we came on, and this is I don't know how to say it, medicine. It's a medicine, but yet you're still not taking pills or prescriptions for pills and stuff like that. This is a healthy way to get them back healthy.
That's right. And right now the opioid epidemic is a real big topic in the political realm and in the therapy realm and the medical realm. And therapy plays a big part in that, because we can get you off of some of those medications, with exercise, movement, positioning. We can help you or give you a plan to take care of yourself without going to the medicine cabinet.
And you actually do from the very young to the very elderly.
That's right. We've seen them as young as 6 months, 6 weeks to 106. People are getting hip replacements, and we do stroke rehab. So the older population, and then the younger population with injuries, fractures, breaks, anything like that.
Now, 6 week old.
6 weeks.
It take me a while to figure that out. How does a 6 week old get injured?
Well, a lot of times it's during the birth. A stressful birth, or you get a stretched nerve in the neck or the arm. Where the arm may become a little paralyzed to a degree from a stretched nerve. So you have to move that body part and stretch it out so it doesn't become frozen. And a lot of it's education for the parents to show them how to do it, how to move it, because the motion will come back. It just takes some time to get it moving.
You got those parents eyeballing you too. You better get it right, man.
That's right. We just show them how to do it, and usually those things come back with time.
Now, how long have you been doing this?
I've been doing this 20 years. Okay. Yep, 20 years. I've been, started out at Russell Medical Center in Alexander City, and slowly worked my way back home.
Now, on Fort Williams here in Sylacauga, you got a great staff. Who are they?
Dan Shable is our physical therapist. He's been with me for 4 years. I have Abby Allen. She's a recent graduate, been with us for 2 years. Abby's a physical therapist assistant, and then myself as a physical therapist assistant. So we have 3 licensed staff. Now,
is this insurance oriented, to use insurance and stuff?
We take most insurances. Okay. There may be 1 or 2 out there that we're not in contract with, and probably not because we don't want to be, but they're just not accepting new payers at this time. But there may only be 1 or 2. We take all insurances, and if we don't take your insurance, we'll definitely work with you for payment plans. We can take cash as well, so we don't like to turn anybody away.
Now, you have a good rapport with doctors, and they recommend you guys to a lot of people.
Yeah, this will be our 5th year. April will be our 5th year, and it seems like all the docs are happy to have a place that they can refer their patients and know they're going to get quality care. And we communicate with all the local doctors, Birmingham doctors, Montgomery, Oxford. We see them from a pretty good wide range. So
can people just walk up to and get treatment, or how does that work?
Well, yes and no. You can walk in and get an evaluation. So if you have an ache or a pain, a back pain, you pull something in the yard, you're at the ball field, and you have something that just doesn't feel right, definitely you can call and come in for a 15, 20-minute consultation. We'll look at you, see what's going on, and kind of steer you in the right direction. Hey, you may need to go see the doctor for this, or this is what we think's going on, and kind of lead you and guide you in your care.
Is back pain one of the most common things that you see?
Back pain's definitely by far the most common injury and
I guess
pain
it's
that we
maybe
see.
the toughest to treat.
It is tough to treat, but then again, it's not, because people just need permission to do the right exercises. And a lot of times they're just putting themselves in bad posture and bad positioning at home where they're sitting at their desk at work. And usually if you can correct a few things that they're doing work-wise and home-wise, those things clear up.
Give us a few tips of proper posture.
First is your sitting posture. Usually you're going to sit and this chair here has a pretty decent back, but I still have to come off of it to keep my shoulders off, so I'm not really using the back of my chair. So posture is key, pulling the shoulders back. It's all things that we know to do that, your mom whipped you on the back and said, hey, sit up straight, Jimmy Dale. No slouching, Jimmy Dale. And your teacher told you that in school, sit up straight. So it's all things we know to do.
Obviously it didn't work with me, did it?
But as you get older, you don't have that person.
Yeah.
You don't have that person following you around telling you to stand up straight and sit up straight. And so that's the main thing, is posture. I would say 75% of all the back trouble that we have, of the radiculopathy, the pain down the legs from the low back, and the pain down the arm from the neck, is usually all posture. You're doing something at work where you're slouched over and you just got a bad ergonomic setup. So you want things computer screens at eye level, chairs that are a good position for your keyboard, knees at the hips or above when you're sitting in your chair. You don't want to sit too low, don't want to sit too high. You just have to have a good ergonomics. And we can teach you all of that stuff for homework. We see a lot of truck drivers, heavy equipment operators, and they have to, go back to their jobs and evaluate how they're sitting and how they're doing things.
Yeah. Ben Donahoo, our guest of Donahoo Physical Therapy this morning. I'm just assuming, not really knowing, this can be a proper answer for people who think, well, surgery is only going to take care of this. That's
right, and we see that every day. Every day we have a patient come in and says, doc says I'm going to have surgery, or man, this arm just feels like, I'm going to have surgery. And after 3 weeks, 4 weeks, maybe even 6 weeks of exercising, getting those muscles strong around that joint, I didn't have to have surgery. I feel great. But you have to keep the maintenance up on those things to avoid surgery. It's not just a one-hit wonder.
Yeah. How do you instill discipline in people to, keep on with the treatments, keep on with the therapy?
It takes 3 weeks to build a habit. And so most therapy programs are geared around 3, 4, and 5 week programs. When you go and see your doc, he writes you a prescription. It's probably going to be 3 to 4 weeks, 2 to 3 times a week, 3 to 4 weeks, because we want to start a habit, and that's the key for you coming in for that. And then after that month or that 5 weeks, you should have formed a habit to take care of your specific problem. You shouldn't have to come back to me again for that problem. Now you may have something else come up, or what you're doing may not work for your problem anymore. We may need to tweak that, but for that specific problem, you should be able to take care of that. We're giving you tools in your toolbox to take care of yourself. No pills, no, magic creams. It's just you stretching your body, what God gave you, and taking care of it.
Isn't that the right way?
I think it's the right way. And that's why we're so passionate about it. And we take it personal. When you come in and you've got an ailment or a pain and you just don't know what to do, and we take it personal to sit down with you and try to figure it out. And, we want to figure out everybody. We're not able to figure out everybody, but we take it as a personal challenge, and we're just passionate about helping people. And
I've been in visiting, and your staff, makes people feel like that they're important. Their problem becomes your problem with a solution waiting to arrive.
That is correct, and that's what we do, because myself and Dan and Abby and Lisa, we're geared to one thing, and that's helping the people. We want to get your problem solved so that you're happy and you're adequate with taking care of yourself. And that's our only objective. That's what we're there for, is to make you feel better and to teach you how to take care of yourself.
What are some of the exercises that you teach I know it's different for different people with different needs, but some common exercises that maybe people can even use without coming to see you.
Yeah, lots of stretching. We do, I mean, most people are not as flexible as they need to be. And then as you age, your muscles lose flexibility as well. So we do lots of hamstring stretching, you know, touching your toes, hamstring stretching. If you've got a bad back, you may have to do that laying down versus standing up and just bending over and touching your toes like you see athletes do on the athletic field. Some people don't need to be doing that because of back trouble. Stretching the hamstrings, general movement, bicycles. We don't use a treadmill a lot, but just walking outside. You know, those are things that we need to incorporate into our daily lives. Stretching, walking, movement. You know, that's what therapy's all about, is about movement. These bodies were made to move, not sit in a chair.
When we come to you, oftentimes, you know, we're down the road a little bit with our struggle, our pain, and stuff like that. And in treating, everybody's an individual. Everybody has different needs, and you try to make sure that need for that person is met. This is a long-term deal. It's not a fly-by-night thing, and you know, a lot of us are overweight. You know, we're not healthy, and when we come to you guys, that can help us in a lot of ways.
It can help because a lot of people can't lose the weight because they're in pain. Right. They can't walk because of knee pain. I can't, you know, get out and do yard work because of my back pain. And so they're not moving and they're not exercising because of their pain. So if we can take that pain away and give them some tools to ease that pain and manage it, then you can get out, exercise, walk, you know, feel better and start losing that weight that most all of us definitely need to do.
And help us stay out of the medicine cabinet. You know, that's whether it's opioids or whatever it is, we're an over-medicated society, to say the least.
That's right, and all those medicines have a side effect. You know, whether it's a small one or a large one, they all have a side effect. So the least amount of medicine you can take, especially on the pain side, because that's just covering it up. It's not fixing your problem, it just covers it up and makes it feel better. Then we can give you positions, exercises, and movements to take that pain away. Then you don't need that, and it just makes your quality of life so much better. And we've had people, veterans, come in that have been taking pain medicine for 20, 30 years. Wow. And we get them in there 3 or 4 weeks, get them stretched out, get them moving, and you know, and I have a 65, 70-year-old gentleman sit across from me in tears saying, I hadn't taken pain medicine in 2 weeks. You know, the first time in 30 years. Yeah. You know, that motivates you, you know, and kind of, you know, hey, this, what I'm doing is I'm doing good stuff. So that's good.
People watching this morning that they're under a doctor's care, what do they need to say to their doctor to get you guys involved in the process?
Yeah, you just ask about therapy. And most doctors know about therapy and they know what we do, and we treat a lot of people out of surgery, you know, to keep them from damaging the surgery and doing the correct exercises. But just fitness and in general pain and health. You know, if you go to your doctor and you have an ache or a pain and your doc just says, hey, well, let's just try these pain pills for, you know, 30 days or 60 days, and they give you a supply, you can just ask, but what about therapy? You know, you think therapy could help me, and your doc can write you a prescription. Like I said, you can call the office, come in for a consultation. I'll give you your list of your problems right there on a sheet of paper to take to your doctor and say, hey doc, I went over and I talked to Dan and Ben and Abby over at Donahoo Physical Therapy, and they said this plan might help me. Your doctor takes a look at it, compares it with your medications and your diagnosis, and said, yeah, you know, Joe, I think this will be good. Go over there and let them give it a try. Or he'll say, no, for your condition, you know, you may not need to be doing this kind of stuff, you know. So you'd let your doctor communicate with our staff and their staff to figure that out.
Got a Facebook page or anything?
We are on Facebook, Donahoo Physical Therapy. We're on Twitter at Donahoo PT. We have an Instagram page. We update that with different exercises and techniques and stuff from time to time, new stuff that comes out. Our dry needling program, we put details on that because everybody's usually got questions about the needling because it's not really a traditional method of treatment, but we're getting a lot of good results with it. So you can see some techniques of that online. with those procedures as well.
Quick 2 minutes on the needling that you're talking about.
So the needling, small needle, thin, maybe the size of a piece of hair, a strand of hair, goes into the muscle. A little different than, or a lot different than acupuncture. It's not acupuncture. This is one single needle going into a trigger point of the muscle, down as deep as it needs to go. You know, some of our needles are several inches, and some of them are just an inch.
What does it do?
It actually resets that muscle. So when the needle goes in, you'll get a small twitch response from the muscle. The muscle just actually relaxes from that twitch response, and then there goes your trigger point. Some people just need one treatment, and that if you've got that one spot of pain, you know, usually we can treat it with that.
Wow. To find out more, get with your doctor, and recommend them to you for Donahoo Physical Therapy on West Fort Williams in Sylacauga. Been always a pleasure, sir. Thanks for coming.
Thank you.
More Daybreak. We're back with the weather right after this.